My name is Bowen, CEO of Northwestern Medical Center, and your host of the NMC Health Beat Show, dedicated to discussing important healthcare topics of interest to our community. This is an exciting day. I have three special guests. I have Anna Gabaree, who is the nurse manager of the Family Birthing Center. I also have Emily Baker, who is a nurse at Northwestern's OB/GYN practice, and Maureen Matthews, who is an international board-certified lactation consultant who works at the Birthing Center. So today we're talking about some exciting news, and we're going to be hearing about a baby-friendly designation that we've just received at Northwestern Medical Center. I couldn't be more excited to have you here today, so thank you for being here.
Thank you.
Thank you.
All right, so let's pop the news. What is baby-friendly designation? What does that mean?
So it means a lot. So really, basically, Baby Friendly is an international organization that was developed in early 90s by UNICEF and the World Health Organization, and it's really designed to recognize birthing centers and hospitals that adhere to certain standards, evidence-based standards for optimal infant feeding and support mother and child bonding. Becoming baby friendly is a really comprehensive journey. It entails lots of training for staff, chart audits, policy developments. It's a really in-depth program that they've developed internationally. So after being reviewed by the UNICEF headquarters, Northwestern Medical Center was designated, which is really exciting. The criteria are challenging, but they're designed to set standards for optimal infant feeding and getting our moms and babies off to healthy starts in our community. So we're really excited about this designation.
That's wonderful. Congratulations. Yeah. I know it was a lot of work, over 3 years or something to...
Yeah, 3.5 years.
3.5 years.
Yes.
So this wasn't just an easy checklist, right?
No, not at all. It was very comprehensive.
So what was the criteria that you had to meet for baby friendly?
So basically, there are 10 steps to baby friendly, and you'll see the 10 steps posted throughout the hospital, but it really breaks down further than that. But as a high level, the 10 steps are policy development. All staff in the organization are trained on how to find the policy, how to carry out the policy. Specifically, birthing center nurses and OB nursing staff are trained in over 20 hours of combination of classroom-style teaching and one-on-one time with our lactation consultant, Maureen. It's expected that all mothers are informed about infant feeding prior to delivery and how to initiate breastfeeding. We support mothers in breastfeeding within the first hour of delivery. We're all educated and support moms if mom and baby are separated at all for any reason, how to initiate and maintain lactation during those stressful situations. We give babies no food or drink other than breast milk unless it's medically indicated or the mother's choice. We practice rooming in, we encourage cue-based feeding, we encourage skin to skin, and we give no pacifiers or artificial nipples to breastfed infants. And then one of the most important things is we've established really good relationships with our community partners, and encouraging our mothers to do continued breastfeeding education after delivery through groups and supports in the community. Wow. So that's really the high level basis of baby friendly.
Wonderful. That's a lot.
Yeah,
I can see why now it took so long, or seemingly. So why is this important for you?
So really, it's allowed us to deliver patient-centered care, to really improve health outcomes for moms and infants within our community. It's elevated the standards of our birthing center. It's forced our staff to really be current in their knowledge related to infant feeding and infant best practices. And it's really exciting because it's helped us meet the Joint Commission standards. And then also, it's helped us to meet like the CDC guidelines, the American Academy of Pediatric recommendations on infant feeding. So it's helped meet these national guidelines and goals like the 2020 Healthy People goals. It's really, we're meeting them and exceeding those national standards that a lot of facilities aren't able to meet yet.
Because I noticed you've mentioned a number of organizations that sort of sponsor this or endorse it. So do they have other recommendations or whatever? You've mentioned some already, but is there anything?
They absolutely do, but I'm going to pass that question on to Maureen because she's our expert.
Hi, Maureen.
So all the professional organizations essentially recommend the same recommendations for infant feeding. So it's exclusive breastfeeding for the first 6 months, and that really means nothing except human milk. Mother's milk for babies.
Okay.
And so for 6 months, just breast milk. So no water,
Okay.
no rice cereal, no juice, no nothing, just breast milk. And then from 6 months to a year, gradual introduction of complementary foods, so table foods ground up for the baby. And in that period, it's really just taste and texture, the complementary foods, and you continue breastfeeding until a year. And then beyond a year as the baby and the mom would mutually desire. So that's really the recommendation from all the professional organizations. With the exception, the WHO actually recommends to continue breastfeeding for 2 years.
Oh, really?
Yeah.
Interesting.
Yeah.
That's very interesting.
So those are the professional recommendations.
Okay.
Yeah.
So what are the benefits of breastfeeding, actually?
So many benefits. First of all, it's optimal nutrition. You cannot replicate human milk. It's just not possible. It's very designed exactly to meet the nutritional needs of an infant over time. So human milk changes over time to meet the specific nutritional needs of the baby. So most everybody has heard that it helps prevent diseases and illnesses. So for a baby, it helps reduce the risk of lots of infections. So ear infections, upper respiratory, so coughs and colds, stomach bugs, lots of disease prevention for both mom and baby. So for baby, it helps reduce the risk of certain childhood cancers, type 2 diabetes for both mom and baby, reduced risk of obesity. The list goes on and on.
Wow.
Reduced allergies. And for mom, it also means less bleeding, so less chance of anemia after the baby is born. And also huge for many, many women is a reduced risk of both breast and ovarian cancer.
Wow.
That's
It's amazing.
just the skimming the top.
Well, thank you for that. So what if a patient chooses not to breastfeed, and how do you support that patient?
So most of the principles of Baby Friendly are applicable to all families. It does not matter your feeding choice. Things like skin to skin is beneficial for all families, all babies. Rooming in, cue-based feeding. The importance of proper positioning and latch is important for any baby. It doesn't matter your method of feeding choice. And we support them through education, just like we do any family. Yes, there's a large focus on breastfeeding because that's the current recommendation for optimal infant feeding. But if you choose not to breastfeed, the CDC and the World Health Organization have very specific guidelines for infant formula feeding. So we'll individually educate our families on formula preparation on an as-needed basis. And the goals of the Birthing Center, Northwestern Medical Center, and Baby Friendly is really to strive to educate our families. It doesn't matter their feeding choice. They need to still be properly educated on the guidelines, and we'll support them 100% of the time if they choose not to breastfeed, and we'll give them the same education and tailor it to their specific needs.
That's great. I think it's important for everybody to know that it is a personal choice. I mean, there's much benefits for certainly, but
Absolutely.
that you support their decision no matter what, and you wrap around them for
Absolutely.
success. That's terrific.
Yeah.
So, is there anything a mother can do to prepare for these type of recommendations so that it works well for them?
Yeah.
So preparing for these, we have a lot of things that we do in the office before the patient gets to the delivery floor. So they're not bombarded with too much information all at once when they get there. They kind of have a little bit of an idea of what the floor is about. We have a variety of education that we give in the prenatal office. They have a visit with me in the third trimester. It's a one-to-one visit touching on what Anna said. We kind of go over some important topics like skin-to-skin contact, C-section concerns, types of breast milk, the benefits of breastfeeding, the risks of formula feeding. So there's definitely a variety of information that gets covered. In the first trimester, we give out a breastfeeding book. So the very first bit of information that they get is in the first visit that they have with us. And that book is recommended by the organization, and it goes through all the material and information that's going to be followed through with them all the way to their care on the delivery floor. In their second trimester, we give information on
That's on a lot of positioning and latch, isn't it, in the second trimester?
Exclusive breastfeeding, feeding demands and cues, positioning and attachment, things like that. So the nurses in the office can go over examples. We provide a variety of different information. We have PowerPoints, we have models, we have babies that we can do demonstrations with, we have handouts, and it just depends on the patient's learning process and what is going to work best for them, so we can adapt to the model that we need to adapt to. And then we have Healthy Beginnings, which is an organization that...
I heard about that.
Yeah, so we'll have a provider from the office, and it kind of joins us along with the delivery floor. So a provider from the office, a nurse from the office, and then we will have either Maureen, the lactation consultant, or Anna herself, or a nurse from the delivery floor, and they'll do the breastfeeding portion. So it's an hour-long class, and it really gives the patients a much more time frame to consult with each other and have a group setting where everyone can bounce ideas off from each other and get much more information that they need to have. And we really focus on breastfeeding towards the end of every class and go over material each time.
Nice. So you're helping them prep. So what happens after the baby is born? How do you keep that wrap going so it continues, because it's 1 year or longer? So what's it like after? What support do we give?
So in the hospital, they get a lot of support. The nurses are all, as Anna mentioned, really highly trained, and they get a ton of support in the hospital.
Yeah. Good.
Then when they leave, of course, they get support from their pediatricians. And then we have a 2-week, we call it our 2-week postpartum Healthy Beginnings visit. And that is a visit that's jointly done with myself and Katya, the PA from the office, from the OB office. And we really do a good check-in on breastfeeding to see how breastfeeding is going there. If they've chosen to formula feed, we make sure that that's going okay. We talk a little bit about returning to work strategies, because that is a time where moms are really vulnerable. It's really challenging. It can be really challenging to continue that breastfeeding when you return to work. So we focus a lot on that. We do go through pumping and how to pump properly and how frequently to pump to maintain a woman's milk supply, and some general return to work strategies, because it's stressful for the baby and the mom to return to work. So we focus a little bit on just strategizing daycare and breastfeeding. We also talk a lot about birth control. And Katya does that piece. And women are also pretty vulnerable sometimes in the postpartum period with respect to postpartum depression. So it's recommended, most of the professional organizations recommend to do a postpartum depression screen. So we do that at that point. We don't discuss that screen. Katya looks that over, and if there's any concern, she contacts the woman directly. So in addition to that, we have an awesome community in this area. I'm really always amazed at the level of breastfeeding support that happens in the community. So we have 3 breastfeeding groups that one is done jointly with myself and the Department of Health, the peer counselors of the Department of Health, and that's called Lactation. That's at the hospital. There are 2 other groups that happen in the community to support breastfeeding. So lots of services that continue. We also have, every woman is offered a postpartum lactation consultant support with Franklin County Home Health. So pretty much, and they pretty much all accept that. And then they're contacted and the lactation consultant from Home Health will go out and see them. They also have our peer counselors at the Department of Health, and the Department of Health in general, our WIC office is tremendously knowledgeable and supportive of breastfeeding. So they get a lot of support there if they're a WIC client. You guys think of anything else?
Another thing that I can think of is we also do an extended follow-up. It's a 6-week postpartum, so they kind of meet at the 2-week and set them up for the resources and to meet with everyone in the community. And then we also have a 6-week where they'll come into the office. We can follow up with them right before they return to work. So any lasting concerns, any other resources, if I need to reach to the delivery floor or we need to reach to WIC or Home Health to get them the resources to, maintain the breastfeeding and this organization while they go to work, because that can be kind of a stressful time. So that's kind of the last follow-up that we do before they're on their way.
Wow, this is so exciting. I mean, you're telling this whole story, and as I'm hearing it and how you get them started and get them connected and you wrap around them and their choices. And so it just feels like such a healthy, comprehensive process and experience for the mom and their family and, of course, the new baby. So congratulations and thank you for, spending so much time to kind of figure this all out and to really advance the care of the mother-baby experience. So thank you so much for that.
Thank you.
And our time is ended. It went so fast. It's so fun to hear everything. And I do want to say one other thing, though, because I have to toot your horn. Now, there's only 300 hospitals in the nation that are baby-friendly, and we're one of those. Mm-hmm. And there's only 2 in the state of Vermont.
Yes.
So it really is time for celebration. This is not easy to do. And so I want to congratulate you and your teams for a job exceptionally well done, really trying to take the best care of mother and baby. So thank you so much.
Thank you.
You're welcome.
So this is Gabaree Bowen, CEO of Northwestern Medical Center. I couldn't be more proud that we are a baby-friendly organization. Thank you.